The U.S. Centers for Medicare and Medicaid Services has determined that the Guam Memorial Hospital no longer meets the conditions for participation in the federal Medicare program, and they have initiated a process that they warn could eventually lead to the termination of GMH's Medicare provider agreement. The findings are the result of a recertification and complaint survey done by CMS at GMH on May 27th. The results were communicated to acting GMH Administrator Ray Vega in a letter dated last Friday. The letter was written by CMS Certification Manager Rufus Arthur and addressed to GMH Administrator Ray Vega. Vega says he first saw it in his email Monday morning.
Why couldn't you release it immediately, publicly?
I have to, it's a thick document, and we'd like to have the ability to evaluate the content of that and to apprise the board of trustees also. And at the same time, given that we're the only hospital, we want to make sure that the rest of the stakeholders have the ability to evaluate the report.
In his letter to Vega, CMS's Arthur writes that the survey documented that Guam Memorial Hospital was not in compliance with all applicable conditions of participation for hospitals participating in the Medicare program. And Arthur writes that these deficiencies are of such a character as to pose immediate jeopardy to the health and safety of the agency's patients. Vega, however, says that the complaint has to do with the physical environment in which the patients are cared for, the condition of the building, not the quality of care at GMH.
Since the physical environment of the hospital deals with the preservation of life and the safety of the patient and the community, they're citing us on that particular condition of participation.
So you're saying that they are citing you not for the medical care of the patients here, but for the physical condition of the hospital?
That is correct. They only cited us for the life safety code, meaning the physical environment of the hospital.
Vega declined to release a copy of the CMS survey report until he receives board approval, but he says the immediate danger to patients cited in the letter referred to fire danger and not medical care.
This letter says that the deficiencies, even if they are structural, are of such a character as to pose an immediate jeopardy to the safety and health of patients here at GMH.
They are referring to in the event that there is a fire, the door locking mechanism has to be meeting the National Fire Protection Code. And this is where they're citing us under the physical environment.
Again, you're not being cited for the medical care of the patients.
No, we're not.
CMS's Arthur gives GMH 10 days from receipt of the letter, which is next Thursday, to submit evidence that GMH is undertaking actions to correct these deficiencies. Mere plans are not enough. Evidence of action must be provided.
What will you tell them in 10 days?
Well,
do you have the money to make the corrections and to?
Some of these projects actually are ongoing. They are fully funded. Some have 50% completion, except that at the time the survey was done, they cited those non-compliant instances. So since they take the physical environment, the life safety very seriously, they have to call those non-compliance issues.
And Vega says he is confident that GMH will not lose its Medicaid certification.
We are confident that we would be able to provide response that is responsive to what they were looking for.
And avoid the termination of your Medicaid.
That is correct.
Certification.
Yes.
You're confident?
We're confident that we will not lose the certification.
Kevin Kerrigan, PNC News.